Okay, so allow me to share my screen first. Okay, so where is it? Okay, so today is the mystery of skin allergy. Okay, so allow me to go through my slide. By the end of today, what I will go through is what is skin allergy, what causes skin allergy, and how to stabilize skin allergy, and how to prevent skin allergy naturally. Basically, like Gary Gunn say, medicine free. Yes, it's actually achievable. So first of all, I would like to take this opportunity to thank the KPT Kangen Power Team International who actually invited me to share this great topic to everyone, whole world. Okay, so and other than our chairman of KPT, Mr. Gary Gan, and his wife Lily. Okay, so please thanks him for sharing and actually inviting everyone to participate in tonight sharing. So of course, because of Mr. Gary Gunn hosted it, he put so much of effort to design everything, invite the whole world to group together and listen to this, the mystery of skin allergy. Okay, so of course, a little bit introduction of myself. My name is Dr. Chen, a medical doctor by profession. I graduated from Kurs State Medical University from Russia. Okay, and my working background, I have 11 years medical experience. When I back to Malaysia, I work in the largest hospital, which in my city, which is Hospital Kuala Lumpur, the biggest hospital in Malaysia. And I was trained in ICU, intensive care unit. So basically, this is the area that it actually gave me the idea why I need to do so much. During in intensive care unit, basically we are actually fighting with the undertaker. Why? Because we need to save a lot of patient. And in the end of the day, basically we are race for against the time. Because if you miss out some time, basically we will lose our patient. And we are actually, I'm very happy I trained over there. Why? Because we able to save a lot of patient and people. But one thing make me very sad is after all the doctors in ICU save the patient and the patient go home happily, but they do not know how to take care of themselves. They do not know how to prevent the disease and end up come back to ICU again. So this make me all our ICU doctors is very sad. So that's why I actually practice in preventive medicine. So a little bit disclaimer about it actually all about my experience in ICU experience. I use advanced medical technology, ICU experience and technology to support all my patients. So why? Because different experiences have different management. So doesn't mean that today Dr. Chen share all the information is conflicting with all the doctors. No, because every doctors have their own way of management. Dr. Chen's management is actually more on using ICU experience to share with everyone. Okay, so I have my own clinic, my pharmacy, and a wellness center in my place. So and like just now, I share with everyone, I focus in preventive medicine. Talk about preventive medicine, doctors have two categories. We have a curative medicine and preventive medicine. All the doctors in the whole world who actually graduate from university must go through curative medicine, which is we give medication, we give injection, we give operation, all this, which is under category of curative medicine. In preventive medicine, we more focusing in healthy lifestyle. Basically, I'm more focusing happy, healthy lifestyle. If you practice healthy lifestyle without happiness, basically you also is not healthy also. Okay, so generally it's scientifically proven already because if you take good care of yourself, prevent yourself very good, you actually push your body to make it healthier. Okay, so what do I specialize? I specialize in pre and post hospitalization management because just now I shared I work in ICU before. I know my patient in and out, but I want to prevent my patient coming back to hospital. That's why I said pre and post hospitalization. What do I can support? Which area, what direction that I can support? Like diabetic patients, like stroke patient, heart diseases, kidney failure patient, and cancer patients. So even though pre and post hospitalization patients, this category is my area of expertise to support them. So I don't conflict with hospital doctors. In fact, I integrate, I collaborate with hospital doctor to maximize the benefit to allow the patient have a healthier lifestyle and have a healthier body. Okay, so I also have a opportunity, glad to share with everyone, have a small achievement in Malaysia, have a Golden Wellness Award to help more people to get healthier. Okay, so come back to the reality now. So like today's main topic, okay, as everyone can see in this picture, okay, the skin, rashes, redness, everything. So may I ask everyone in the audience, do you think is it annoying with that? Okay, please communicate with me. If you think it's annoying, please press a yes. If no, then press a no for me. I will wait for everyone's feedback. I think today we have 238 audience over here. So at least I have 50% of audience typing, responding back to me, okay? So while I'm waiting, I'm still waiting. So if you think the skin allergy is annoying, then please press yes for me. If no, then please press no for me. Okay. So I received a lot of yes, and someone said it's super annoying as well. Okay, yes, I agree with everyone. Okay, according to World Health Organization, based on the statistics shown that more and more people having skin allergic issue. Okay, so today I would like to share with to everyone, to the audience, what is actually skin allergy. As you can see the picture over here. Okay, you can see over here urticaria and rashes. You can see skin rashes, hive, and urticaria. Okay, like contact dermatitis, sometimes you touch on certain chemicals. Okay, as we can see, the skin is actually become like this, very irritated and annoying as well. Like the legs, the foot as well. Okay, contact dermatitis and eczema. Okay, come to this eczema. A lot of my patients will ask me, Dr. Chen, is eczema skin allergic? Because sometimes they actually consulted to some of the professional, they say eczema is not allergy, but allow me to share with everyone. Okay, there's a lot of type of eczema. Number one, eczema is it allergy? For your information, allergy is atopic dermatitis. And some more, in order to have this atopic dermatitis, is actually allergic disease as well. So basically, eczema still under category of allergy disease. And if everyone stay tuned until the end of tonight, you will have the secret of how to overcome this allergy disease. Why? By very natural way. In fact, you can, if for all the audience who actually taking medication now, I can quite confident that if you are a very serious patient or candidate, you can reduce 50% of your medication. Okay, so I have a video to share with everyone. It's a skin specialist from India. Okay, hello from India, friends. Okay, so you might know him also. Okay, so this is a video we'll share with us about the skin rashes, urticaria, to allow everyone have a brief understanding about this skin allergy. If everyone cannot, if lagging, no problem, because I will do a summary for everyone by the end of the video. It's just a 2 minutes video. Just stay tuned, just focus and listen carefully to our skin specialist. Okay, so we will look into it now.
Hello friends, I'm Dr. Rohit Batra from Dermable Skin and Hair Clinics, and today we are going to talk about skin rash, hives, or as we call it, urticaria. Urticaria or skin rash is an allergic condition in which people develop rash, red spots on face, body, and at times can develop swelling of lips and eyes too. That is known as angioedema, and it's one of the severest form of allergy or urticaria, which can be life-threatening at times also. So why does urticaria occur? Well, urticaria or allergy or skin rash can occur because of anything that your body is not coping up. It might be something you are eating you are allergic to. It might be something you are inhaling that you are allergic to, or you are applying something, or even if you are having an infection in your body, you're going out in the sun because of the heat, because of the temperature changes, and at times because of water also, if you are bathing, that's known as aquagenic urticaria. So urticaria can be of many types, can be of many reasons, but once you are suffering from itching, redness, rash, you need a treatment.
Okay, so let's come back over here. So allow me to talk about the summary of it. Okay, summary. Skin rash or hive and urticaria. Urticaria is actually allergic condition. And basically, generally, is the body is not able to cope. Okay, and if severe, like certain cases, it can be life threatening also. If actually any one of you are suffering of it very badly, please look for treatment. Okay, this is the summary for our skin specialist from India. Okay, so it's very good. And I would like to share one important information to everyone, all the audience. The most important thing is what causes skin allergy. Because if you want to overcome the problem, of course, we need to identify the causes and face it. Okay, so this is my 11 years of medical experience to conclude own personal experience in skin allergy. Okay, so there is actually got certain type of it. The first one is food allergy. So as you can see, certain candidates or certain individual cannot take certain products, food like milk, shellfish, seafood, egg, tree nuts, all this. The first is food. Okay, so the second is the medication. Like certain, I believe everyone of you all have certain friends have certain medication cannot take, maybe paracetamol or antibiotics. Okay, so the third is the chemical, like certain perfume or shampoo, everything. Okay, so also can trigger skin allergy as well. Number four, insect bite. Insect bite, which is as we know, the insect will actually release the toxin when they bite on your skin, and then it will affect the skin layer of your body. Okay, so the final one is the environmental, which is the most commonest, and we have a lot of challenges to manage on this. Okay, so I will go through with everyone. Please pay attention on this slide. Okay, so first, as we can see here, it's actually we call it air pollution, dust, water pollution, unhealthy food, what else, radiation, and stress. Okay, so all this is part of the reason of having so-called skin allergy. Okay, so imagine all this. May I ask the audience, in your country or in your city or in fact in your house now, anyone who have these five, if you have five, just press five. If you have one of it, you just press one. If you how many, you just press. Are you facing all this issue? Like in currently in this picture, how many challenges that you are facing? If you've got all five of these, just press five. You've got three, you just press three. Okay, so let's see. We do a survey. Okay, so I see Jeffrey Long put 10. Okay, so if some is putting zero, very good. Okay, so most of it is more than some of more than three. Some if some of our friends is actually zero, congratulate to you. Okay, very good. So basically, this is how the world it is. So in the end of the day, we are end up so many friends and patient having skin issue. Okay, so come back to it is how to stabilize the skin allergy. Okay, like as you can see in this picture, before and after, if you do the correct things, it will recover very fast if you do the correct things. Because skin allergy, for your information, it should not permanent unless you don't take care of it or unless you did not receive a proper or correct management. Okay, so there's a how I usually advise my patient when my patient come to see me. Yes, there's three way to stabilize skin allergy. If the skin allergy is very serious and the patient cannot take it and cannot tolerate, so definitely medication and injection. That is a very critical, very severe. It might be life-threatening as well. So that is the option number one. medication and injection. Okay, so of course there's a second option is, which is we have to avoid the triggering factors. Like just now I said, if imagine all this is the triggering factor. If you eat something unhealthy or allergic food, you will have allergic. Of course, you need to avoid it. Or maybe environmental like dust or acid rain, all the chemical products which hit on your skin as well. Okay, so the third one is actually boost up your system. Why I emphasize on this one? If to all my friends and audience in here, if you do not wish medication and you also cannot avoid all the triggering factor, the only way you can do is boost up your system. Why? Because in order to boost up your system, your digestive system, all the system, lymphatic system, endocrine system, detox system, recovery system, it will all boost up and they will do all the necessary thing and it will recover. What they actually help you to do is actually automatically help you to detox and reduce the inflammation. Why? Because skin allergy is basically it's an inflammation in your body, in your skin. So, and once the reduced inflammation, everything settled down, the recovery stage will come, and generally your body will be stronger and healthier. Okay, so I have another video. This video is talk about how curative medicine treat the skin allergy. Okay, so and I will let everyone have a differentiate curative medicine and preventive medicine. Okay, so let's watch this video together.
So once your dermatologist has made a diagnosis that you are suffering from urticaria, then what are the options you have? You have oral antihistaminics that are the drugs which are given or are specifically known as anti-allergics that are given. There are non-sedative anti-allergics. There are some few old anti-allergics which can make you drowsy at times. Then you have oral steroids, you have cyclosporin, and many other drugs like biologics that we have nowadays to give you a symptom relief, not only for the time being, but in the long run, especially those who are suffering from chronic urticaria, which keeps on coming back again and again. So if you're suffering from skin rash, allergy, or it's itchy, first require a diagnosis. Many a times people confuse urticaria with other conditions like scabies or eczema, dermatitis, and thus they keep on self-medicating, thinking that they're suffering from a skin rash.
Okay, so generally all the doctors, curative doctor, in order to support the patient, we all will give medication or cream, as you can see, cream to stabilize or medication. So if our friends, our audience today, if you're facing long-term skin rashes, skin allergy, then like I only can advise you only have three choices. Choice number one, either you have a very serious condition, then you look for doctor, receive medications, cream or injection. Option number two, which is we call it, you have to find your triggering factors and reduce it or avoid it. If not, it will keep on coming back. Why? Because it's just a reaction. Like you holding a very hot item, you felt hot or burn your hand. If the triggering factor will trigger you to have a skin allergy reaction, as long as your triggering factor still surrounding you, then you will keep on coming back, just like dust. Okay, imagine, please tell me, in the city where got anywhere have no dust. Generally everywhere got dust, and dust is the most commonest things that actually affecting our skin. Okay, the third way is you boost up your body to make your body stronger in order not to have this allergic reaction. Okay, so there's so many of choices, and which choice that you going to choose? Okay, you prefer medication or lifestyle? So in the audience, may I have a feedback from you all? You prefer medication, please press 1. If you prefer lifestyle, please press 2 for me. Okay, so I'm still waiting. Okay, so we have 264 audience over here. So I'm looking forward that have a 50% of the audience is responding to me or actually communicating communicating with me. So I repeat my question again. If there is a choice, if the effectiveness is the same and the result is the same, which one you prefer? You want medication, number one, or you want lifestyle, number two? Please respond to me, please. Thank you. So yes, okay. So I have a lot of two over here, yes. Okay, of course, I don't think anyone will like medication, okay? So then, thank you for the feedback. Okay, then because you are choosing two, you are at the right platform. Why? Because I will share how to prevent skin allergy after this, okay? How to prevent skin allergy? As we always say, prevention is better than cure. Or everyone is agree with this statement, okay? A little bit talk about prevention versus treatment. I need to put one disclaimer again to everyone, to all the audience. For your information, prevention is not treatment, okay? Prevention is not treatment, okay? So please make this statement clear, okay? And generally, what prevention can do, it actually reduce the risk of getting worsened, okay? And it actually increase the success rate of recovery faster, stabilize better, okay? So reduce the risk of prolonged skin allergy and become worsen, bleeding, everything, okay? So why? I always tell all my friends and my patients, the best doctor in the whole world is you yourself, okay? Because generally, if someone who take good care of yourself, you do not need doctors or you do not need medication at all, okay? So because your own doctor will push your body to make it more healthier, okay? This is also another statement that everyone agree with me. Okay, so I have one top secret over here, which is the secret of I learned from ICU to help my skin allergic patient. So I will, do you all want to know this top secret or not? The ICU secret, how to use a natural way, non-medication way to help, knowledge to help skin allergy issue. So if everyone, please, if you all want this top secret, the ICU knowledge, top secret, then please press yes for me. So I receive vitamins are under medication. It depends on organic vitamins or synthetic vitamins, okay? So vitamins still under, we call it more on lifestyle natural, okay? So I'm still waiting. Do you all want to know this top secret? Okay, if you want to know this top secret, please press yes for me. Okay, so today, this secret is actually everyone knows it very well, just only they've forgotten. Okay, the hospital ICU just focus it so that all the patient can get the benefit, and all the doctors in the ICU they follow this very thoroughly. Okay, and generally this top secret you can practice at home, very easy. Okay, so please pay attention. It's actually 4 very important helpful tips. Okay, so if you in front of you, if you have paper, please prepare a paper and prepare a pen. Okay, so the first one, okay, number 1, the first tips is actually you have to improve your knowledge. Okay, like just now our skin specialists they said about you need to have a diagnosis. You have to improve your knowledge in order what you are dealing with. Okay, why? Because knowledge plus action is power. Okay, because of everyone in take action today, at least you will gain some knowledge. Okay, I hope that by end of the section you will learn something about this and you got the benefit of tonight's section. But I can quite confident and guarantee that you will get some of the secret back home and you can help yourself and your friends. Okay, so tips number 2, what is it about? Exercise. Okay, why exercise so important? Because it will help you to increase the circulation. All the doctors, even though all the health advisor, they all keep on emphasizing exercise. Okay, please invest some time, go for exercise. Tips number 3 is you need to have a sufficient rest. Okay, so why? Because your body, when they need to recover, they need to repair, they need correct timing, they need rest to recover. Okay, tips number 4 is the most important part. Okay, why? Because it's the 4 basic necessity of life. okay, there's a 75% of it. If you do not have this, you will die. Okay, what is it about? We call it food, air, water, and shelter. Okay, if you do not have air, 3 minutes, you will die. Water, 3 days. Food, 7 days. Okay, shelter, in fact, it will help you to recover faster. Okay, like what I want to go through with oxygen, water, nutrients. Okay, balanced diet. Okay, like, and the shelter. Imagine why the hospital patient can recover so fast, because they have a good environment, they have a good area to support them, allow them to rest properly and recover faster. Generally, if you can set up your home in a good environment, you also can achieve this benefit as well. Okay, so allow me to share some of my case study that I supported on this skin issue before, so that you all can have a more understanding what I wish to deliver to everyone. Generally, I still have not give you what is the ultimate secret of it. Okay, so I will share my case study, what I along these 10 years, how I support my skin allergic patient. Just a very, I think I put on 4 cases. Okay, I have a psoriasis cases is actually more than 30 years. There is a story in this. Okay, allow me to take some time to share with everyone. Okay, this psoriasis patient, there is actually mother and daughter. Mother already 70 years old, and she already have psoriasis for past 70 years. She already looked for whole Malaysia for all the doctors, all the curative doctors, skin specialists, government and private hospital, everywhere. So the patient itself is actually receiving medication. So for so many years, because the psoriasis is very bad, until bleeding, very itchy every day. So the patient was forced to use medication until 70 years old. On one follow-up in the hospital just recently, the patient was actually diagnosed kidney failure because of old age and certain long-term medication. So the mother got a daughter, is 30 years old, and the daughter, 30 years old, also got this issue, psoriasis issue as well. So the mother accept her fate. She go for dialysis, and she shared to her daughter if there is an alternative way to improve her condition, just by all means, just go ahead. So the daughter is referred one from my good friends. So the skin is actually like this. So how was it? It's whole body, the face, all the skin. Basically, the patient every day is rashes, itchy, hot, warm, and then bleeding as well. This is the patient was using medication to stabilize it. Okay, so the patient asked me, Dr. Chen, is there a way to cure this? I said I cannot cure it, but I can stabilize it. So I use a very natural way. Basically, I use just now the 3 necessity, the oxygen. I asked the patient exercise well, and then I use the protocol of water, and then the good nutrient. So just 3 months. After 3 months, the patient without any medication will receive this result. Okay, as you can see, this the left hand side, on my left hand side is actually we call it the patient, but even though using medication, they also cannot receive this result. So on the right hand side is actually using a natural way. The patient is actually happy with this. Why? Because at least the patient no need to take medication anymore. Okay, sometimes the patient took something extra, allergic medication, allergic food, it actually arises, but it can be stable very easily. Okay, so next is a severe acne. Acne, like the skin. This is an 18 years old girl. She actually visited, also visited a lot of skin specialists. The skin specialist also offer her the antibiotics. Yes, every time she take the medication, it recover, but it keep, once the medication stop, it keep on coming back. That's the problem. So in our preventive medicine, what we usually understand is hygiene issue and internal toxin. Okay, so when this patient come to me, yes, I do use medication, I use medication to stabilize the condition, and I also teach the patient use the natural way. And after that, after 1 month, and this is the result. In fact, the patient stabilize very well, do not need to long-term use medication. That's why I say if you use the correct way, basically you can reduce the usage of medication at least 50%. Okay, so next, this is okay. This patient is a foreigner. Okay, number one. Number two, she came to me. She all the while she actually used supplement. She very happy with the supplement. Before supplementation, the patient, the whole skin is very itchy and cannot tolerate. So she come to me, ask me, is there any better support to stabilize her condition or not? Okay, so since she's taking supplement, I say please continue with supplement and then just add on kangen water. Okay, so this water she actually drank the next day. It actually reduce the itchiness, the redness is lesser, and then it actually the third day third day it actually dry out. Okay, so this is the considered the fastest effect that I ever see, because the patient use supplement together with the water, so it actually stabilize very fast. Okay, so and got some more. This is one our KPT Kangen Power Team partner in Johor Bahru. In fact, I never see this patient before. It's a foreigners also. I just summarize the storyline about this patient. This patient is a maid. Is a foreigner's maid. She actually worked in Malaysia for a few years, and this issue have disturbing her in a minimum more than 6 months already. Okay, she actually visited, have the opportunity visit doctors or pharmacy to buy the cream, but it never recovered, and in fact, it wasn't until the whole leg like this, very itchy, and then the patient fall into depression, and the owner also want to send her back to her country because it's worried, and the patient is very sad and very we call it intolerable suffering. In fact, she also looked for doctors, and the doctor also cannot help. Why? Because the doctor give the medication, while taking medication is stable, but once it actually stop the medication, it come back, and the patient scratching everything. And what? So why I need to share these cases, even though I never see this patient before, is the if you use the correct way, even though you don't see a doctor, you also can recover. Basically, this patient I never see before, and I just ask the patient use the correct natural way, and as you can see, just only 1 month, this is the result. Okay, of course, the patient still use aqueous cream to apply, and then this is after 1 month, and by only use a very natural way, and this is the result. And thanks to Mason sharing this case, because I consulted Mason, and Mason follow up for me. Okay, because during this MCO in Malaysia, I was too busy, I cannot follow up. I teach Mason, and then the Mason helped me to follow up the patient, and this is the result. So imagine, that's why I say in ICU, I feel very sad for my friends or my patient if they do not know how to take care of themselves and end up go to hospital. What if you can just change a correct method, use the correct method, you basically you can save your own life, your skin. Okay, so my case sharing is all, this is all my cases that I managed before. Of course, I still have a lot of cases, ugly cases also managed before. Okay, so then the question, a big question now, how come the patient cases visited doctors, the clinic doctors, or in fact maybe skin specialists, how come they cannot manage or help the patient? No, in fact, it's just a way of helping. Okay, why it's actually, yes, please consult professional, ask the doctor, please ask the doctor, but remember, please ask the correct doctor also. Because like what I mentioned, I train in ICU. I usually race for time. I speed up the recovery. I can speed up the recovery for at least 50% of the patient because I use ICU knowledge to help my patient. Okay, there is a slight difference compared over there. Rather than, because I treat all my patient, I help all my patient, like treating them as a very critical condition. And why? Because if you do it correctly, you can recover very fast, and that is the result. That is the difference why other doctors, yes, they treated, they stabilized, but they cannot they did not talk about the preventive part. Why? Because they do not have time mostly. Okay, but my area is I do not wish my patient have these recurrent issues. So usually I participate in educating them how to take care of themselves in a very natural and very easy way. Okay, so generally, like what I mentioned, Dr. Chen's protocol is basically using ICU's protocol. Okay, so okay, then try to imagine. Okay, everyone. Today we have how many? 272. Please imagine. Okay, imagine a road just like your skin. Just imagine a road just like a skin. And this road have a lot of lorry, big lorries, okay? And the big lorry just like allergen or bad things or toxin, which on your skin, okay? If every day big lorry, big allergen that run on the road on your skin, basically you will damage your skin, okay? So yes, you look for specialists. The specialists, what they will do, they will try to give you cream, give you injection, give you medication. All this is good. Why? Because they stop the big lorry, they stop the allergen, they stop everything, they stop the harmful substances to your body. But even though you stop for 1 month, after 1 month later, do you think this damaged skin will recover itself? Okay, may I ask to the audience, if 1 month later, even though there's no lorry or there's no damage has been done, do you think this hole will recover automatically? If you think it will recover automatically, please press 1 for me. If you think no, please press 2 for me. Okay, I'm still waiting. We have 268 audience over here. Okay, there's no way. Logic, very logic. Okay, imagine, yes, you look for doctors, doctor help you to stop the allergen, doctor help you to stop the bad substances. But if you don't put the feeling back to it, how you are going to recover your skin? Okay, so imagine, that's why every time you apply cream, every time you take the medication, it actually stops the itchiness or irritation. But you did not supply to your skin how your skin recover. So in order to recover, you at least you need to put the filling, you need to put the cement, everything together, so that only your skin will recover. So generally, the hospital doctor, or we call it curative doctor, that did a very good part, which is they stop the damaged substances. And the doctors expecting all the patient take good care of themselves. If not, if you don't take good care of yourself, of course, you will keep on repeating, coming back. Okay, so that is the difference. I actually integrate. I not only stop it, I also help to repair. So that's my differences management compared to the doctors. Okay, so of course, like what I mentioned, the important thing is 4 basic necessities of life: the food, the air, water, and shelter. Okay, so it's very important. I always admire with the Hippocrates, the father of modern medicine. Okay, why? Because there is a very good quote: "Let's food, let food be the medication and medicine be the food." Okay, so I believe everyone agree with me. Okay, why? Because I use natural way, I also can receive the effectiveness like medication. Okay, so always there's so many audience or friends or all my patient, they always say, "Dr. Chen, I always take anti-inflammatory superfood." Yes, I agree, very good. Okay, but they actually miss out some small things. Okay, uh, if all the patient who have skin allergy that takes this superfood and high anti-inflammatory superfood, generally, usually their skin is very well controlled. If they're still unable to control well, then there must be insufficient or use the wrong method. Okay, so I also want to preview out the most important secret of this controlling the anti-inflammatory condition. Okay, so did you know water is actually part of diet? Everyone just now talk about food, diet, okay, and water also part of diet, and it actually also is anti-inflammatory also. Okay, So a lot of my patients, they keep on putting so much of fruits and vegetables and vitamin, but sometimes they still forgot water. They actually maybe some drink juice, or maybe they will drink Coca-Cola or all this. So basically, this is a very important reminder for all the friends or audience. If you are taking supplement, good, go ahead. Just add on something. Water is part of your diet. Okay, why? So imagine if your body rashes, red rashes, like on fire, your skin on fire like this. So which one do you think that the most easier way to reduce the inflammation? Is the diet more easier or water more easier? I also do another survey. If you think diet more easier to reduce your inflammation in your body, please press 1. If you think water is a more easier way to reduce the inflammation, please press 2. Okay, so yeah, please, I'm still waiting. Okay, so yes, the diet is very important. Water also is part of diet, but like we need to use effectively and efficiently. There's no correct or wrong. Depends. You want to raise the time. So I, as a doctor, it's my duty to make sure my patient recover fast. That is my main objective, to support my patient. I'm still waiting. Okay, someone said both. Oh, okay. My question is, which one more easier? Number 1 is diet, or number 2 is water. Which one is more easier to reduce your, to consume, to reduce your inflammation? Yes, I know both is good. If you're able to take both, is the best. But usually I see so many patients, sometimes they have challenges. So of course I need to guide them the most easiest way. Once they have stabilized, they have confidence that we can go better. Okay, so that is the most important part. Okay, I believe everyone 100% is agree with me. Drink water. Okay, so and from that, from my side, I always have a protocol to manage the skin allergy. Okay, usually the first protocol, I definitely need my patient to drink sufficient water. If they don't drink water, I cannot treat them. I also cannot help them. Okay, even though I'm a doctor, if they don't unable to follow the easiest way, also cannot follow, then I don't think I can help them. Okay, if you want to help yourself, please drink sufficient water. But of course, talk about water, I also need to guide them to use the good water, correct water. Imagine if you drink, okay, then I do a survey. In Malaysia, or maybe I put this way, water, we drink water. Imagine you prefer drink a river water who have a lot of rubbish, river water, or filtered water. Okay, if everyone think that you want to drink river water, please press 0. If you think you want to drink filtered water, please press 5 for me. Okay, so if you drink water, you prefer choose a river water not sure is it clean or not, you press 0. If you prefer drink a water with filtered water, you press 5. Okay, most of it fine. Yes, we need to choose the correct water. Not every single water is your correct water. Okay. In fact, for skin allergy issue, also you need to choose the correct water. And my protocol, usually I need to use a microcluster water. Why? Because you have a smaller molecule, you have a better absorption to your body, and then allow your body to recover faster. Like in hospital, we usually do IV drip. We drip 500 ml, 500 cc water all in. So we drink water, we still will sometimes absorb, and then sometimes we sweat out. So all this take into consideration as well. Okay, next is the high active hydrogen water. Why? Because it actually helps us to fight neutralize the, we call it, neutralize the free radical, because the free radical also will harm your skin and then to delay your recovery. Okay, so I also need ionized alkaline water. Why? Because usually unhealthy body is very acidic. Okay, acidic body. Okay, and it actually helped me to balance the patient. This is the 4 criteria. If the audience, if you can, in the market, you can find all these 4 category congratulate to you. You can continue use it. Of course, please find the correct and the suitable one and the good one, because like what I mentioned, correct water, microcrystal water, high active hydrogen water, and ionized alkaline water. So the following is my own preferences that I suggest to my patient and my friends. Okay, I'm not this is part of my protocol to support my patient. I only recommend, in the market there's a lot of ionized alkaline water, they are good, okay, but what I use is actually I recommend the Allergic company Kangen water. Why I introduce this one? Because they're certified safe and effective, certified safe to use and very effective. And all the cases is actually the protocol I introduced them is to use this water, okay? And in fact, there is certified of what is ISO 13485. Okay, in the market, there's so many ISO 9000 or part of the certification that is we call it food grade, and the ISO 13485 is we call it medical grade, which is used in the hospital. In the hospital, Japan hospital, they use this device to support their patient. Okay, so generally, if you use the correct method, basically we can from impossible become possible. The skin allergy, basically, if you do it correctly, you can U-turn. Okay, so for more information, please get back to your friends and please say thank you to your friends who invited you here. Why? Because at least you have the opportunity to listen to me, to get this small secret, and I hope this small secret can benefit you, you yourself, your friends, and your family members. Okay, so please be thankful to your friends, and if you everyone possible, please type thank you to just to show appreciation to your friends. Okay, so and following, I always share this to all my patients and my friends. Like, true prevention is not waiting for bad things to happen. It's actually preventing things from happening in the first place. So, like, may I ask to the audience, you prefer, this quote is like this: you prefer you have a sickness, go to hospital and treat, or you want to prevent things happening first? Okay, so if you think you want to wait until you sick and go to hospital, please press 1 for me. If you want to prevent your sickness or skin allergy properly, then you please press 2. So 1 is to wait the sickness very serious and then look for doctors in the hospital and treat, or you prefer take good care of yourself and prevent sickness come to you. Okay, so generally everyone also agree with me. Okay, so that's why I say invest in prevention. Do not wait for the disease to arrive. Okay, preventive health is good for people and the environment. Okay, if you suffer, everyone suffer also. Okay, especially your family members. Okay, so generally your health is in your hand. Okay, if the audience, if you have this issue, like you have skin issue, decide now and act now. Why? Because you are racing against time also. The more you delay, basically you actually will worsen your condition and it will more difficult to support yourself. Okay, so, and a very special thank you to the audience, the people who actually come and join us today and to listen to my sharing. And of course, especially thank to our chairman, Mr. Gary Gan, the KPT Kangen Power Team International, and the hydration specialists, all the hero in this team. Okay, why? Because they are truly is the hydration specialists who actually supported a lot of people. Like, just now I share a case like Johor Bahru. It's a 500 kilometer away from me. I did not see a patient, and the Kangen Power Team hydration specialist save a patient just using the correct water only. Okay, so, and thanks to Allergic company and the Kangen Power Team Malaysia team, and in fact we also have international partners over here. So thank you very much. I end my sharing over here. Back to you, Gary Gan.
Thank you, Dr. Chen. Guys, if you all had amazing, superb value today, can you just put at the chat bottom, at the chat button there and express how you feel after listening to what Dr. Chen has shared. Maybe if some of y'all have more hope, you know, that maybe all this while, you know, is actually, to be very honest, this skin problem, skin disease, like what you have seen from Dr. Chen sharing, is really, really annoying. It's very, number one, is painful, it's annoying, and a lot of times, a lot of people has no idea, okay, no idea whatsoever how to treat it, how to overcome it, and they go from creams to medications to injections, and yet the thing is still there. And now here comes a doctor called Dr. Chen giving us not just a solution but a drug-free way to avoid this issue. All right, so Dr. Chen, while you are still here, there are a few questions that actually was asked by a few people on the chat button just now. Dr. Chen, are you there? Maybe he went for
Yeah, yeah, I'm here. I'm here. Just to
You're there, huh?
continue.
Okay.
Yes, yes. Come,
Right,
please.
okay. Dr. Chen, somebody asked if I don't drink much water, will I have skin disease? From Keith Tan.
Okay.
What do you think?
Okay. Our body is 70% is water. If you don't drink water, your body still can survive. Not only skin, you also need to take care of your internal area as well. Like our body got a formulation of calculation. Let's say your body weight divided by 20, that is your ideal water intake. That's number one. If you have insufficient water go to your body, basically you are exhausting your body. Imagine like a car, the water is just like a fuel. If you don't put a fuel into your car and you force your car to move, do you think your car will be spoiled? It will spoil. So your car still can move, but you will spoil your car. Your water, your body need water. If you don't drink sufficient water, maybe you don't realize it, but your internally will receive damage. So that is why you can choose not to drink sufficient water, but you also will face, we call it equilibrium. When you do something incorrect, you will receive something not good for your body as well. Okay, so please reconsider, consume water more, so that at least you will have a healthier body. To answer your question, if you don't drink sufficient water, will you get the skin disease? Depends on your body. If you are young, you might not. If you are elderly, slowly you might have this skin disease issue. Okay, so I hope I answered the question. Back to you, Gary.
Okay, thank you, Dr. Chen. Dr. Chen, can I just add on to this question that this person is asking? What actually, what is the, how should I say, what is actually the cause or the activation of this skin disease? Is it due to bacteria or is it due to hormonal balance, or what do you think, Dr. Chen?
Okay. Just now I said there's a few triggering factors, like the four things. Yes. I mean, food and anything that your body cannot accept it, cannot cope, they will actually start to have this. It's a reaction. We call it a signal. Just like imagine a fire. A fire. You touch on fire, you feel hot. If you receive something your body cannot cope, your body will start itchy. It's just a signal. Itchy is just to inform, oh, like imagine my skin, my hand now got dirty, got dirt, got dust. So your hand receive my hand receive a signal that send itchiness. So ask me to attention over here, there is something. So ask me to clean it up. If I don't clean it up, more itchy, it will start to rash, scratch. So it actually initially just a signal, and then it also can be too toxic, like insect bite, and then it will eventually become more few things like swollen, itchy, rashes, and then you go and scratch, and then your nails got all the bacteria, and then you scratch on it, you bleed, and then bacteria will go in, so complication will come. So just now to answer Mr. Gary Gan, is it hormonal? Yes, all the factors can be participate. Like certain patient, like there's a two candidate. One candidate is very strong, skin is very strong. One candidate skin is very sensitive. They go to the same place in the factory, got same a lot of dust. But this candidate will be very itchy, but this candidate is very strong and he don't feel anything. So it depends on your skin toughness, strength. Okay, so hormonal also take into participation. If your body too toxic, also can have this issue. If your candidate who have constipation issue also have this problem. Why? Because your body is very toxic and you have a higher chance to have skin allergy compared to other. So it all depends on every individual. Okay, so I hope I answer you, Mr. Gary Gan.
Yes, thank you, Dr. Chen. Doctor, from Noli Rasmi, is pigmentation considered a skin problem? Pigmentation.
Need to see the picture first, number one. Pigmentation, from my understanding, because we need to have the same information to answer it correctly. Because from my understanding, pigmentation, we call it dark spot. Okay, dark spot is actually due to certain damage, usually sunlight or UV light ray. Okay, and then it actually cause your skin have the pigmentation. Okay, unless I see the picture, if not, I cannot give a proper answer on that. Okay, pigmentation usually have no itchiness, no rashes, just only pigmentation, dark spot. Okay, if we have the same understanding of her pigmentation. Okay, so if she can send the picture to the person who invited, can connect with me, and then I can share more on that. Okay, back to you, Mr. Gary Gan.
Thank you, Dr. Chen. From Mr. Abbas. Doctor, we've recently received severe psoriasis cases for 8 and 10-year-old kids. They're suffering since they were born. Last 5 days, they started drinking Kangen as well as using beauty and antiseptic water from our Kangen machine. However, their skin get more serious. Why is that so? Is that what we call detox effects or healing crisis? What's your advice, Dr. Chen?
Okay, yes, this is a very common reaction to certain patient. Okay, so you drinking the water is actually stabilizing the patient condition. Okay, and it will stabilize, number one. Number two, like, did you actually supply sufficient? Okay, the irritation, you see the effect of more serious is we call it healing crisis or healing reaction. Okay, so I share this story to everyone, which is I always share so-called healing reaction. Okay, we know drink this water is good for the body. Okay, like it just imagine, also help me to imagine when everyone, if you go to gym with an instructor to teach you how to gym. Okay, everyone know that you go to gym. If you go to gym, you work up with your instructor for 1 week. What result you will see? You basically, you also have a healing reaction of your body is pain. Your body is pain. So if for candidates who never have this experience, that thought, oh, I go to gym is bad for the body. Okay, it same apply to this water also. When you drink this water, your body is actually try to kick off all the bad toxin, number one. The few ways that actually can come out from your body is, number one is urine out, number two passing motion out, number three is from your skin. So sometimes if your body too much of toxin, in fact it will have, we call it flare out. Your skin will actually more red or more itchy for certain of time. That's number one. That's why we need to integrate every individual differently. If very severe, basically we can integrate on diet or supplemental. If very serious condition, we might use antihistamine just to control, just to let it stabilize on that period of time. So remember I say, if a serious cases, I actually, for candidates who are using medication long term or a lot of medication, if you use it correctly, you can reduce your medication. Okay, that is my ultimate aim also. So for 8 and 10 years old child who facing this condition, you can use antihistamine to reduce the itchiness first. Continue with this water, okay, and also you need to supply sufficient nutrient to the body so that it can actually recover faster. And you also need to block all the triggering factor also. If keep on repeating, there must be something wrong, we miss out. And also be careful. A lot of family members miss out the food. They have a impression that take this food is good for them, but in fact it might be actually harming the children also. Okay, so it's very common, and because sometimes 8 years old, 10 years old, they cannot communicate well, so we need to interpret for them also. That is something that usually I need personally follow up. We need to observe what is the condition also. Is it safe to use? Please, it's very safe to use. Please continue use the water, number one. Number two, you have to supply other things. You can consider omega-3 fish oil, and then high anti-inflammatory food like certain juices. Okay, so this is nutrition part. Nutritionist part, I will just pass it to nutritionist team to support accordingly. Okay, so I hope I answered the question. Back to you, Mr. Garrigan.
Thank you, Dr. Chen. There's another question here from QCQCom DTD. Hi, doctor. Please, for the elderly patients, sometimes they have skin rashes, ringworm, scabies. How to prevent and what should we do?
Okay, ringworm scabies is we call it certain infection on the skin. You need to kill the infection first, then only it will not come back. Okay, so if just only you use the drink water is insufficient. Okay, why? Because the ringworm already in your skin layer. You need to kill the ringworm, all this, and then only you recover, rejuvenate itself. Okay, so that's why you need to get the correct diagnosis and use the correct method to treat it. Yes, you might need to use certain antibiotic cream or antifungal cream to apply on it to kill the ringworms first, stabilize it, and then use the water to recover. Of course, you can add an alternative plan, which is use the acid water 2.5 to spray. It actually also can disinfectant to kill the ringworm. But of course, a natural water and a chemical, which one more stronger? Of course, no doubt, medicine chemical will more stronger. So we need to kill the ringworm fast so that you can recover faster. So if you just use a very natural way, we need to use the correct method to heal accordingly. So how serious was it? Because I do not see the picture, so that's why my advice is look for the doctors in your country, in your city. Let them treat the ringworm with the medication, kill it first, and then don't allow it to recurrent. Okay, you can use the acid 2.5 and drink the kangen water. It allows you to recover faster. Okay, so at least it prevent it from getting back again. Okay, so I hope I answered the question. Back to you, Mr. Garrigan.
Thank you, Dr. Chen. Another question from Irene. Is psoriasis and eczema autoimmune diseases? What do you think?
Okay, so it's like this. Psoriasis is an autoimmune diseases. Number one, it's not a skin allergic, but autoimmune diseases is something that is in your body. Anyhow, that patient already need to face it. Okay, so may I ask to the audience? Audience, please answer this question. Imagine autoimmune disease like psoriasis. Like just now, this patient already have psoriasis. You think you input good water to make your body stronger to face this psoriasis better, or you don't do anything or use a poor water to face this psoriasis. If you think input good water to make the body stronger, please press 1. If you think just forget about it, just do whatever you can do, just press 2. So if you think you need to put, okay, so regardless of autoimmune or not autoimmune is not important anymore. You still need to live with it also, okay? You need to face it. So what we can do is just make your body stronger, put all the good things, put good water, and then at least make the patient more stable, okay? Sometimes a lot of friends or patient too sickness orientated. Okay, no, you need to enjoy life, okay? You need to live your sickness together with your life. Okay, if you can cure, good. If you can prevent, good. If you cannot prevent, then just don't allow it to get worsen, okay? So yes, psoriasis is an autoimmune sickness. The eczema just now I mentioned is actually allergic disease, and allergic disease serious complicated become atopic dermatitis, and then atopic dermatitis become eczema. Okay, it's a few complication over there. Psoriasis is totally different. The body antibody is actually attacking your own cell in your skin. That's why your skin is actually receiving damage. So imagine your body is actually attacking your skin. So if you don't repair fast enough, definitely it will spoil. Okay, so your only way is you need to calm them down. You need to repair fast. So it's a race also. A race of allow your body antibody destroy your cell faster or allow your body recover faster. Okay, so I hope I answered the question. Don't too sickness orientated. The important thing is do the correct thing and focus on prevent and recover fast. Okay, so back to you, Mr. Gary Gan.
Okay, thank you, Dr. Chen. Another question from RH, and he mentioned, Dr. Chen, what is the cause of SLE? And did SLE inherited from our parent?
Okay, it's also another autoimmune sickness as well. It's a very troublesome, also same like psoriasis. SLE is more serious compared to psoriasis. Okay, it actually not only damage the skin, it actually damage the blood, the organ as well. I just supporting a SLE nephritis patient, which is the autoimmune system is attacking the patient kidney. Okay, and not only that, the joint as well. So generally, the patient is actually suffering the joint pain, inflammation. The patient cannot sleep well. Okay, yes, I cannot cure so-called SLE. I cannot cure psoriasis, but at least I can make the patient more comfortable, stable, rather than it get worse. Okay, so the patient also take my advice, drink the good water, and then use the good supplement, and then do exercise. At least her body is more stronger to live longer life. Okay, so as Gary, what's the question again? I actually too excited in SLE already.
Wait 1 minute. Let me go.
So is SLE treatable? It's not treatable. Is SLE can support?
Okay.
Yeah.
He says, what is cause of SLE, and is SLE inherited from our parent? Is it like inherited disease?
Okay. From our study, our data, yes, 50% yes. And some of it is actually born with it, and some of it is actually at the starting part, no. And then suddenly triggered by certain radiation or bone marrow disorder issue, and then the we call it mutation of your gene or mutation of your bone marrow. That's why they have this SLE issue. Like some since birth got this issue. Some this patient is after 16 years old, then only she detected she have SLE. Okay, so there's no definite answer. I don't see importance of this question also. The problem is we need to prevent it. Generally, that is my answer to the audience. Okay, so back to you, Gary.
Okay. There are a few more questions here. Hi, Dr. Chen. My son is from T Chan. My son has skin asthma since he was born 6 years ago. He was admitted in the hospital because of skin asthma, and the allergologist requested for a immunoglobulin test to know what has been triggered. But the result says that he doesn't have any specific allergens. Still, his skin asthma is recurring, especially when it's starting rainy season. Do you know what is the very cause of this?
Okay, so may I know which country was it? Well, which country, Mr. Kevin Joy?
Carlin Joy. Carlin Joy,
Yeah.
if I'm not mistaken, I think, are you from the Philippines, Carlin? Yeah, from the Philippines, as I knew
In
it.
asthma and the allergologist request for a immunoglobulin test to know what has been, but the result said that he doesn't have any specific allergen. Still his skin. Okay, so do not require, no need to question about the skin I mean, the skin specialist, everything, or even though allergy specialist, okay? So they know what to do, but there is one issue. In hospital or even though in the lab, there's so many things that trigger. I always trust my patient. The patient signal or the patient complaint is always the important message to me. Why? Because they are suffering. Okay, so doesn't mean that you cannot detect. Doesn't mean that it's not happening. It's actually happened. Like this is something very, not to say new. Okay, I also manage a lot of skin specialists that cannot find a reason, but my objective is, if I can find a triggering factor is the best, but if I cannot find a triggering factor, then the only way I can do is I help your son make it stronger to face this issue. Okay, so of course, who are more qualified to find your triggering factor? Of course, the skin specialist and the allergy specialist. Okay, if they can't find, I hope that I can use my best way to find it. Usually I do we need to identify, like, always this a few triggering. Most probably you can consider take food allergic test or DNA test. You can look further on that. In Malaysia, we do that. Okay. In fact, I have a patient. We have a cooking oil. My patient allergic to cooking oil. So never have. I mean, all the specialists also got a shock. And then generally the patient every time takes food who have a cooking oil that actually have allergic, the lips will be swollen, everything. Okay, there must be a reason. I need more information to identify it, number one. But for the meantime, what you can do is, anyhow you still have not find the triggering factor, the only way you can do is make your son body stronger. That is my advice. And continue look for doctors or anyone who can help your son. Okay, never give up. Maybe today Dr. Chen cannot help, please keep on look for doctors or people who can give a hand to your family members or your hand. Never give up on that, because I recently also help a patient. My patient is a female. She visited 9 hospitals, look for 9 doctors, and all the specialists. She quite sad and disappointed, because she said all the specialists in the hospital don't understand what she is telling about, and end up did not get the help. And she come to me and then explain to me, I actually find a very small issue is actually is on her diet. Okay, just change her diet, solve the problem already. Okay, so that's why sometimes it's just surrounding you only. Okay, so I understand I did not give you a definite answer, but definitely find a way to make your son stronger. Okay, so that's my answer. Back to you, Gary.
Thank you, Dr. Chen. We have one question from Jeanette Borman of South Africa. And she asked a question, Dr. Chen, do you have advice for dermatitis allergies that is due to household chemicals? Is there such a thing?
Yes, it's very common. Like your perfume also can, your household chemical, then you only can use is we call it chemical free product. That's number one. You need to find something that chemical free or organic, lesser chemical. That's number one. Number two, in fact, if you can boost up your detox system, if you can boost up your strength in your body, you actually can overcome this issue by few months to 1 year. Okay, so what you need to build up your strength. Okay, so and then avoid all these triggering factor. If not, you are putting toxin in your body. You're putting toxin in your skin, so your body is actually alarming you only. Your rashes, your allergic dermatitis is actually telling you that this chemical is harmful to your body. So that's why it keep on signaling you. So since your body did a good job signaling you, then you don't torture your skin. Okay, just remove all these bad things from it, and then just change something nicer, lesser chemical. We call it chemical free. And in fact, you can use Kangen water pH 2.5 to disinfect your house. You can use Kangen 11.5 strong Kangen to wash your vegetables. It's organic. So there is a way of changing lifestyle. Okay, so of course, if you cannot take it, then you long-term medication, like what I always remind all my patients. If skin allergy, basically there's no cure. You need to face it. Either you long-term medication, or you find the triggering factor and stop it, and then or you make your body stronger. This is all my advice to my patient. If you don't, basically there's no other way. This is my conclusion. Okay, this is my experience. Okay, so back to you, Mr. Garrigan.
Thank you, Dr. Chen. Dr. Chen, since you're on this topic about like household chemicals, you know, in this short period of the coronavirus era, everybody is going out there to buy hand sanitizer, alcohol-based hand sanitizer. In your opinion, does the hand sanitizer that's alcohol-based or whatever that you see out there, chemical-based hand sanitizer, is that also, I mean, will that affect skin allergy and skin disease as well? What do you think?
Yes, the answer is yes. Okay, depends your priority. You want to kill the germs or you want to kill your tissue. Okay, if you want 100% kill your germs, of course you use alcohol base, and indirectly you also will harm your skin, especially for sensitive skin candidates individual. Okay, why? Because the alcohol also got grade. We have the best grade is form type, like bubble. The form type is the lesser chemical and the quality is better. The second grade is, we call it gel type, jelly type. Okay, the lowest grade, the most toxic is solution. Okay, spray one. Okay, there is a very toxic, we call it, there's a few grade, we call it pharmaceutical grade and industrial grade. Usually industrial grade is very cheap, but the problem is the toxicity is very high. So, and if long-term use on your skin, you might have an allergic reaction, you might damage your skin, you might, we call it, make your skin very sensitive, and in fact, you have the risk of certain infections as well. So usually there is an alternative way. Consider hand wash yourself with we call it, what is it? Hand rub, and then household hand sanitizer. Or usually what I do, I use we call it Kangen 2.5. I gargle my mouth, I spray my face. I cannot spray alcohol on my face. It will spoil my face. Okay. Usually what I do, I use Kangen strong acid 2.5, spray my face. Because for your information, no virus or bacteria can survive below pH 3.0. Okay, so there's no virus or bacteria can survive below 3.0. Okay, so usually I in the clinic, in hospital, I see so many patients. When I go home, I usually gargle with 2.5 and wash my face with 2.5. Okay, or you can use soap to wash your face, but usually what I do, I directly spray 2.5 on my face. Okay, of course your eye also cannot, you cannot throw your alcohol to your eye. So I use 2.5 to wash my eye also, but not directly. You just superficially your eyelid. Okay, so that's number one. Number two, to answer Mr. Gary Gan, long-term alcohol solution sanitizer, long-term it will hurt your skin definitely.
Wow.
Okay.
So guys, for especially for those who are tuning in on this Zoom call that doesn't even know what is Kangen or never even heard of it, I strongly recommend you to talk to the person who actually invited you for this Zoom call, because we are very blessed. Those who are currently using Kangen water, you are very blessed because we have an alternative to the sanitizing effect of the alcohol base by having the strong acidic 2.5. And based on my experience, the 2.5 is so amazing because I have drank the 2.5. I mean, again, I'm not here to recommend you to drink it, but I've drank it so many times in basically just for certain cases of trying to kill some bacteria and all that, and nothing happens to me. It's that safe. A water that can kill 90% of germs and bacteria, and yet when you drink it, even accidentally, nothing happens to you. All right, so you guys must really want to check it out with the person who actually invited you to this Zoom call, because it's truly amazing. Okay, it's really an alternative way to sanitize, especially now with what's happening out there. You hear so much of all these virus, people wearing masks. You will want a very good protection. At the same time, it's harmless to the environment and it's very good for your health. All right, so thank you so much. Yeah,
disclaimer is actually we are talking by our own experience. It's not advertised for the company. Maybe you can more emphasize on this one before Energy got in trouble.
Okay, guys, if any one of you are listening to this, I'm just saying it from my point of view. Dr. Chen is sharing it from his point of view, and I'm very happy to say that Dr. Chen is sharing from his heart, his own research, his own way of treating his patient. We are not in any way representing the Energic company that produces the Kangen machine. No, okay. So it has nothing binding with them. So it is just personally my own experience, Dr. Chan's sharing, and you have seen the amazing results of his treatment to his patient, and what are the treatment that he used is strictly on Dr. Chan's way of treating. Okay, so we do not represent the company, we do not represent anybody. Okay, so at this point of time, I would like to say a big thank you, Dr. Chen, as usual. Every time during our health talk with Dr. Chen, your Zoom session, you have always never failed to impress us with all this amazing, eye-opening information that we can actually take home and share it to people. You know, Dr. Chen, I just want to tell you, the last time that you shared on the diabetes thing, somebody actually got back to me and told me after hearing your session, they have such a change in their mindset on diabetes. They did some changes in what you have shared with them. And you know what? The result has been truly amazing. And they were so blessed. They were so happy. They were not even supposed to be on that call. So happened, one of their friends told them there's a Dr. Chen session. They got in, and wow, now the parents that is suffering from diabetes is seeing so much benefit from what you have shared with them. You are truly amazing. So guys, what I'm trying to tell you is this. Both me, Jeffrey, and Dr. Chen, we are not Mother Teresa, we are not Nelson Mandela, you know. But what are we doing? We are just having just one we just have one idea of if this Zoom call, okay, if this Zoom call can just touch somebody's life, can just give hope to somebody, it has already fulfilled our life destiny. In other words, this is what we want to do. I'm definitely, I can see until now, we have been talking already coming to 2 hours now, or more than 2 hours actually. we are still having 219 people on this Zoom call. I believe the information has been very beneficial. And I'm truly blessed because it is not easy, guys. Listen, seriously, it is not easy to get Dr. Chen to be on this Zoom call for a good 2 hours. Dr. Chen is saving so many people's lives every single day. I was at his clinic just like 4 days ago, Dr. Chen, you still remember?
Yes,
And while I was talking to him, his phone was ringing non-stop, and then I can see the CCTV. Everybody is outside his clinic just waiting to see him, you know. So it's truly amazing. We are so blessed. Thank you, Dr. Chen, once again, for all this amazing sharing. And to those of y'all who have been listening to this call, if you've got value tonight, if something that Dr. Chen has shared has opened up something inside you, I hope you can just put in the chat button there to express whatever your gratitude, your greetings. And this posting is actually live right now on the Kangen Power Team International Facebook page. I hope you can actually go there and put some comments. If you have benefited from this, just put some comments there. Say whatever you want to say for Dr. Chen. You know, it's truly our blessing to have all of y'all and to have everybody. And of course, to those testimony sharer, thank you so much for sharing. And before I end today's session, let me give y'all something to look forward to. All right. As y'all know, Dr. Chen is actually doing a health sharing. Okay. We call it the Talk with Dr. Chen series, a health sharing every first Thursday of the month. Okay, so this is the first Thursday of June, and today we are doing the mystery of skin allergy. Guess what? The first Thursday of July, let me just bring this up, okay, so that you can book your time, make sure you are there, make sure you get your friends to be there. It's another big topic. If guys, you all can see this on the July 2nd, which is Thursday, same time, same day, same time, Thursday at 8 p.m. Malaysia time. Guys, I can't be putting all your different times because there are so many people from so many different countries. I would just put it Malaysia time. If you want to know what is the time in your country, please feel free to ask our best friend, Dr. Google. Just put there Malaysia time versus your time. And then you just put at 8 p.m. and see what's your time. So on July 2nd, the Thursday, Dr. Chen is going to share with us the mystery of the digestive and intestinal health, where Dr. Chen is going to share, let me just read this out, where Dr. Chen is going to share about constipation problem. I'm very sure this is going to be another major hit topic, major hot topic. Okay, a lot of people are having this constipation problem. Okay, Dr. Chen is going to be talking about constipation issue, gastric issue, stomach bloating, better nutrition for absorption to your body, indigestion, and how you can get the digestion up again, poor appetite, hemorrhoid issue. Now, guys, can you imagine gastric, stomach bloated, better nutrition, absorption, indigestion, poor appetite, hemorrhoid issue, and constipation all into one session delivered to you by none other than Dr. Nicholas Chen. So you don't want to miss this session. You want to start calling your people and booking their time. Make sure they tune into this session because there is always a hope to people who is suffering from some health issue today. And we are very blessed to have none other than Dr. Chen to actually share with us all these amazing facts, amazing solution that can touch somebody's life somewhere. All right, guys. So without further ado, thank you so much for your time. I hope today's session, audience are asking the recorded version. Okay, guys, if you want, please go to the Kangen Power Team. There are two ways that you can get this video, okay? There are two ways. Number one, you can go to the Kangen Power Team International Facebook page. Okay, you go there. The live session is played there. please do a watch party so you can share it to your community. Okay. And of course, if you can give us a comment there, that will be great. The second way is you may want to follow our YouTube channel, which is Gary Gunn 368. That's the YouTube channel. In about a week's time, this video will be posted as one YouTube video. So you can actually click the link and share it to your people. So there's two ways of doing it. One, go to the Kangen Power Team International Facebook page and do a watch party because the live video is there. And second is to look out for the YouTube channel. If you have not subscribed to our YouTube channel, which is Gary Gunn 368, I highly recommend you to go and check it out there because there are some very good videos, including Dr. Chen's sharing on diabetes, cancer, as well as the coronavirus. All right, guys. Oh, let me see. There's a okay. Can you include? Okay. All right. So once again, guys, thank you for your time. Jeffrey, is there anything that you want to add or anything?
Yeah, just one thing for the audience that stay with us all the way to 10 p.m. Like I said, great value times always have to come to an end. All right. So proud of you guys staying with us all the way to 10. All right. If you have great values today, please go on to our page, Kangen Power Team International. Leave us a comment. All right. For people that are watching this, kindly go now and leave us a likes, a comments at our page. All right. See you guys.
So Jeffrey, what I'll do is I'll unmute all of you so that you can say your thank you, your gratitude to Dr. Chen in whatever language that you want. Okay? So guys, you all are all unmuted now. Wait. Let me see. How do I mute all? How mute all? Allow participants. Okay. Jeffrey, do you know how I can mute all? Unmute all? I only see the mute button now. I don't see the.
Wait, I'm trying.
The funny thing is, this Zoom has updated their thing. It all looks so different. Now you only have mute all, but there's no unmute button.
All right, what we can do, right? Type all your positive at the chat box. Thank you, Dr. Chen and Gary.
Yeah.
For the great host for this session. So much value today.
Guys. Thank you, guys.
Thank you. Good night, everyone. Thank you, Gary.
Bye, everyone.
Thank you, everyone. Thank you, Howard. You're the best.
Thank you, everybody. See you all next Monday, the following month.